Great, thanks, Kate. So yeah, today we have the Alzheimer Society of Alberta and Northwest Territories. They've got some new projects and initiatives that they're going to be telling us about. It's a packed agenda today. You can see them listed there. Navjot will be talking about cultural communities, Christine about dementia supportive communities, Barb around their mobile rural navigator, and then Sarah about palliative approach and grief supports there. And then at the end, we'll just have a few resources for folks, but also to highlight that our November meeting on November 25th is going to be all about asset-based community development and what it looks like in action. We have we're hoping three panelists, two for sure, to come and talk about that. So I think it'll be a really interesting discussion. So I will hand this over to Navjot now.
Okay, is everyone able to see the slides?
We can see your slide deck. Just there we go. Nope, it's still your slide
Nope,
deck.
it's the presenter mode. Okay, I'm gonna see how I can. Why is it doing this? There we go.
It's still in presenter mode. There, oh, yep, nope, we've got it now.
I switched it. Okay, yep. Perfect. Yeah, a presentation is never complete without some tech issues. Hello, everyone. My name is Navjot. I'm the Cultural Communities Coordinator at the Alzheimer Society of Alberta, and I'll be talking about one of our projects known as the Cultural Communities Project. So a little bit of background to where this project came from and why we started it in the first place. So we do know that dementia is a growing public health concern in Canada, and it affects individuals from all cultural and linguistic backgrounds, right? So we know dementia is universal, but unfortunately, dementia care is not. There are a lot of cultural and language barriers, which often delay diagnosis, reduce service use, and increase care partner stress. There's also a lot of stigma around. I'm sorry, there is something very loud going on in the office right now. I'll try to focus. So this diverse communities, they experience stigma and lack of culturally adapted resources, and there's difficulty in navigating services. Due to all of these barriers, this does lead to later diagnosis, more crisis-based care, and poorer outcomes. So along with this gap, so yes, there is stigma around dementia. You know, communities kind of struggle navigating that space about understanding what dementia is, seeking those resources. But even if they're able to get over those initial hurdles and barriers they have, there comes the issue of now what we have the diagnosis. What do we do now? We know you can live with dementia, but you do require the right supports and services in order to do so. Currently, a lot of our dementia support services are in English only and culturally neutral, which does not resonate with a lot of communities. Healthcare pathways often lack interpreters or culturally inclusive navigation, and research has shown lower service utilization among immigrant and visible minority populations, despite similar or higher need. And because of this, again, it just feeds into that stigma, right? Because first of all, you already believe that this disease doesn't exist within your community, then you don't see the representation, you don't see the resources. It just feeds into that lack of awareness and stigma, which then leads to mistrust of formal care systems, right? Because you're not seeing yourself being represented in these spaces. So with this gap in mind, seeing that, yes, and we know from our landmark study, which was launched by the Alzheimer Society of Canada, that there is a disproportionate amount of dementia cases amongst diverse communities, but we do not have the services in place to support these communities. So in order to address this gap, the Alzheimer Society of Alberta and Northwest Territories applied for funding with the government of Alberta, and we were approved this past January, and we started on this project. So what are the project goals? So the goal is very clear. We want to address the gap that exists in supporting diverse communities with dementia care. We want to increase culturally relevant dementia support across Alberta, and we want to ensure more families access care earlier in the dementia journey versus later on. So they're not coming in crisis. They're able to understand and learn how to navigate from the moment the symptoms appear, and then build partnership with cultural leaders and organizations to strengthen equitable dementia services. So we don't want to assume we know everything. We don't want to say, hey, these are our services, we're just going to translate and send them out. We want to work with the community. We want to work with the cultural leaders and organizations to meet the communities where they are, to ensure whatever we're doing is done very intentionally and meets the needs of the community. So the first thing we did was we put together a team. We wanted to, again, this was done very intentionally. We did not want to hire navigators just to create a team. We wanted to make sure the team members that we were bringing on board were, we call them our cultural communities navigators. So these are trusted community members who are not just proficient in healthcare, but they also know the community. So they are from that community. So we have hired a cultural communities navigator from the South Asian community, the Chinese community, and the Filipino community, which has brought up our language capability from just English up to 11 languages over the past 10 months. So we now provide support, and this is not through interpretation services. This is our staff having the capability. So English, Hindi, Punjabi, Urdu, Farsi, Pashto, Dari, which are the South Asian languages, Cantonese and Mandarin for the Chinese community, and Tagalog and Visaya for the Filipino community. So our navigators, they act as cultural brokers. So they go into the community, they're able to understand those cultural barriers, and are able to communicate and meet the community in the safe spaces, which then helps build that trust with the community and the families, and helps them connect to our services. So what I've been doing, so we like to call what we have done up till the fall as our awareness phase, or phase one, which was simply just being out in the community. When we started back in January, just because of the stigma and the lack of awareness, a lot of the organization communities didn't even know that we existed as an organization. So first step was to be seen. So we did active participation in a lot of cultural events, fairs across Edmonton. So we went to the Millwood Sick Parade. We had a booth at the Filipino Fiesta, and we made sure that when we were going to these events, we were connecting with the organizations beforehand to kind of get an idea. Okay, so what kind of people will be showing up, right? What language resources do you want us to bring? So when we were going to these events, we were taking resources. For example, when we went to the Sikh Parade, which was for the Punjabi community, all our resources were in Punjabi. We made sure a staff who spoke Punjabi was available at the booth to answer any questions. And then we also did a lot of targeted presentations with different organizations across Edmonton to kind of just go out and talk about brain health. We call it soft launching dementia. So we would say, hey, we're going to come talk about brain health. And then we would talk about dementia, Alzheimer's, the 10 warning signs. How do you understand the difference between just getting older and dementia, why you should be reaching out to your physician? We also reached a lot of professional audiences through our various conferences and symposiums across Alberta, just because even physicians need to know, or even healthcare providers need to know that this project exists, so they're able to support their patients and able to refer them to us through our first link. The outcome we saw over this past time, so there was definitely an increased program awareness, dementia education, and trusted connection. So we did have a lot of clients who came back to us, and we did end up increasing our client base and support that we were able to provide. Now we have moved into our second phase, in which now we're going to be adapting resources and programming for our clients. And this we are trying to do through our partnership and collaborative initiatives. So we're partnering with different organizations across Canada. As Christine calls it, we don't want to reinvent the wheel, because we know there are a lot of organizations across the country who are doing very similar work. So we want to make sure we're not misusing resources in the sense that, we're starting from scratch. There's already something happening. This is not only taking up valuable time and resources from a non-for-profit, but also delaying this service being available to the families in the community sooner. So with this in mind, we worked with SE Health to bring over some of the culturally inclusive guidebooks they had over to Alberta. We're working with CCNA to develop some of our diet and brain health guides for the South Asian community. We're working with the Alzheimer Society of Canada to bring over some of the projects and resources they're developing for certain communities. And similarly, our partnerships are also just to kind of build that space, because when we do go into our programming for support groups and first link connections, we understand that people may not want to walk in through our door and talk about all their feelings, especially around something like dementia, which is so stigmatized. So we want trusted spaces within the community where our staff will be able to go and facilitate all our programming, so people feel safe and they're coming to a space they already know and trust. So with this in mind, as we are moving through our phase two of our programming and servicing, so we have raised the awareness And not saying that we're not doing it any longer, even as we moved into fall. Now, these two things are going side by side. We're still doing presentations, we're still doing outreach, but now we're also working on adapting some of our programming. One thing we have is called our First Link Connection program. So this is a 2-hour presentation our clients are able to attend. Once they connect with our organization, it kind of takes them over what is dementia, what are the resources and services. Over the past month, our staff has translated and adapted this in 8 different languages, and we're ready, hopefully by the beginning of New Year, to actually start offering this to our clients from diverse communities. We're also working on our other 2 programming, which is our support groups and Minds in Motion. And we're hoping to have these up and running by summer or fall of 2026. And along with this, we have also updated our website called Help for Dementia. And now staff, public, anyone coming can come across this website, our web page, and are able to access languages, support in different languages and resources. Yep, so some of our early outcomes is we have more families connecting with dementia support services, and we have worked on building trust between the communities and our organization. And that brings me to the end. Thank you.
Thanks, Navjot. We do have one question in the chat box there, was wondering if there are any plans or anything in the works for Indigenous languages in this work.
Yes, so that is something definitely we had a lot of conversation going back and forth at the beginning of this project. But like we said, we're very intentional about this because we have to understand that when working with racialized diverse communities, there's also a lot of mistrust and trauma in the past, which makes them hesitant. So we don't want to go in, even if we are going in with the right intentions, but do more harm because we don't understand what their needs are. So this project is titled as Cultural Communities. We do know that Indigenous people do describe themselves as racialized, but they're not a cultural community. Within cultural communities, we're able to put them under an umbrella term because often there's a lack of awareness, right? People don't understand what dementia is, but within Indigenous communities, we do know that they have an understanding of what dementia is. They have an understanding of what Alzheimer's is, but it flows through their values and wisdoms, and we are not currently equipped to be able to support that. Again, we don't want to go in and assume and again do more harm. So that's why we have taken a step back. We do support our Indigenous communities. We do have resources on hand which we're able to provide to them. Our navigators, we do have clients, but we're not, if advertising is the right word, this project as being able to support Indigenous communities because we don't have staff on team who are from the Indigenous communities. I hope that answers that question.
Along to Christine. I do see there's another question in the chat, but I think we can kind of get to some of those at the end of the presentations too. So Christine, I'll let you get started now.
Yeah, absolutely. Well, and even too, while I'm just getting my my slides set up here. I mean, there again, we would love to support all communities, you know, regardless of how they necessarily identify. But we're a small but mighty team, and capacity wise just isn't always there. So definitely, like Navjot had spoke to, we definitely would like to be able to do that at some point, maybe in our future. But right now, this is these are the communities that we're focused on for that. Okay, and speaking of that, so just for folks as well to just have a little bit of a better understanding. Now I think I'm okay. Can everyone see the slides without the presenter view? Or am I
We
still
see you're in the slide mode with the slides on the side.
Oh man, today is just not my day, Helen. Actually, perhaps Kate, I know you have my slides. Would you mind presenting them for me so that I don't hold us up any further? If that's possible.
Sure. Let me just try and bring them up.
And while you're doing that, just further to what Navjot had also shared as well. So these 4 projects are listed as one large project within the government of Alberta. We were funded for the 4 sub projects, and their focus is on Alberta. And there again, as you just heard about cultural communities, but as well as the dementia supportive project, which I will be sharing here right away, and then to my other two colleagues who will also be sharing. They kind of all live under one large grant that we received, which is great.
Sorry,
Very
now
good,
I'm
Kate.
trying to rearrange my monitors for sharing.
I apologize. If it's okay, I might just continue talking if that works. And so we
There we
can kind
go.
of keep things on track. So yes, so the second project that we were funded for was the Dementia Supportive Communities project, and that is definitely focused on how do we go into community and make it more dementia supportive. And I know that for most folks who know Helen as well, she's been doing this work for a lot of years, and so we've definitely gained some knowledge and understanding that has been invaluable to us in terms of how do we do that from our angle at the Alzheimer Society. So the our goal for the DSC project is to aims to create and certify dementia supportive individuals, organizations, and businesses across diverse communities. So you do see a really nice flow between not only our cultural communities project, but our mobile rural navigator project, which Barb is up next, I believe, and our palliative and grief project as well, and just those nice interconnection pieces that we can definitely see shaping into our future work. And so there again, we've chosen the language dementia supportive community. I know there's lots of language around dementia friendly communities. We just felt like the terminology was a little bit more inclusive of person-centered language. I think, both good, bad, right, or wrong. I don't think there's necessarily one right way to go about it, but that's just the language that we have chosen. So they're very similar in the work that we do, but just a difference in language. That's all. And so so it's inclusive places where people living with dementia and their care partners are supported and empowered to live a life with meaning, purpose, and value. And that's what we're hoping to achieve with this. We've got some pretty straightforward key activities and outputs that we're hoping to achieve. I'm looking at my slides as I'm talking to the screen back and forth here. So our target groups are business groups, municipalities, emergency services, community partners, and then there again, that diverse sector piece. And Helen was very, very informative when you had said to us, look for the champions in the communities. And so these are who we're hoping to target and to find those champions within those different target groups. And again, so our engagement right now, similar to what Navjot had shared about the Cultural Communities Project, right now we're just in a place of awareness and trying to find communities where we're able to find those champions and those people that hopefully are looking to kind of create more of that inclusive space. So we're focused on mostly the Edmonton area at this point, but with plans to definitely expand that piece and hopefully throughout the province, just depending on where we find those people in those communities. Right now as well, we have developed a initial online asynchronous learning piece. So it's about a 20-minute module about how do we start building out that learning within community. And that's accessible for everyone and anyone who wants to access it. We intentionally made it to be a shorter learning so that folks who are from all kind of parts of these target groups have the opportunity to do that learning, as opposed to, trying to commit, a few hours, which isn't always doable for folks. And as well, just there again, the attendance of community engagement and what does that look like for us, and creating that awareness that this project is around and we're available, and as well too, our long-term goal towards probably the end of 26, 27 is to build out those ambassadors within community, and they're again, those champions to kind of carry the work further, further down the road. And I'm not sure if that's me sharing, Kate, or if that's you.
It's me.
Okay. If you wouldn't mind, so there's if slide 7 just showcases or just is just a photo of what the learning actually looks like, where you can find it on our Help for Dementia website. So yeah, there again, it's just for short courses. We are building out a larger learning at the moment. There again, for those people that can commit more of a time commitment to that learning. But right now, this is what we're working with. And at this point, we also have partnered, or we had an agreement with the Brenda Stratford Foundation. For folks that are familiar with them, they had also done a pilot project back in 2019, where they had built out dementia-friendly communities, and they have very graciously gifted us all of their resources. So we're going to be looking at also incorporating those into our future learning, rebranding, working with what we feel like fits into the course load as well. So that's a really great, it's a really great opportunity for us to, continue a pilot project that was from a few years ago and keep that alive. So yeah. And then finally, I think that's actually, yeah, no, I think that's about it. I feel like between my slides not working and just one of those days today. So I'm going to stop sharing. And anyways, thank you very much for the opportunity for us to come and share our projects and the work that we're hoping to achieve with all of these. So thank you.
Thanks so much, Christine. We all have had those experiences on our technological.
One of those days.
That's right. Thank you. So I think we're over to Barb now.
Well, we'll see what adventures are in store for me. Are we seeing what we're supposed to be seeing?
Yes.
All right then. Now I just have to be able to advance the slides. So I'm Barb. I am the Mobile Rural Navigator Coordinator. This is, again, one of the new projects that we have underway. And just a little bit of, that's not what I want to be doing. So the need for the mobile rural navigators, over the course of the past 10 years or so, the client services navigators at the Alzheimer Society have spent countless hours on the road, going up, doing outreach, doing community presentations, meeting with doctors, meeting with healthcare professionals, to connect with the rural community and the clients that we know are there. We've had some results, but not to the level that we've hoped. We certainly know that those rural clients that we do have, a lot of them are coming from doctors located in our major centers, where we have people coming in to an urban center and seeing a physician, rather than from those rural physicians or rural healthcare professionals themselves. And there's that disconnect between the urban and the rural. So what we looked at was having staff in those rural areas being able to connect with those healthcare professionals, those communities, and those clients that are there. So what this project is, a team of client services navigators who are located in specifically targeted communities and who serve their community and surrounding areas. We currently have 4 mobile rural navigators who started through the spring. We are looking at hiring 2 more in the next little while to serve additional areas that we're targeting. And that would fulfill the requirements of the grant to have a complement of 7 staff, including the coordinator. And our funding does go through till the end of June of 2027. What the objectives of this project are is to, plan formal partnerships with the primary care networks, continuing care, home care, day programs, build some new relationships and partnerships with FCSS, other community organizations. Again, that's the value of having our mobile navigators located in community, knowing who are those champions, who are the connection points for the members of those communities. Looking at creating more collaborative relationships with other organizations, and again, allied health, Alberta hospice, palliative care, continuing care. We're, continuing our relationship and connection with the Mint Clinic that's located in Whitecourt. We are looking to provide, continual support services to continuing care homes and programs. Again, with these mobile rural navigators, we're able to bring our programs and our supports and our resources to community rather than have only online options available, or having families only able to access things in person if they are coming into the city. This is kind of a rough map of the areas that we are serving. So currently we do have somebody based in Wainwright who is doing kind of that eastern stretch. We've got somebody in Camrose who's doing a bit of a east central. We have someone at Olds who's doing kind of that, central swath there that includes, Drumheller and Hannah and Didsbury. We do have, Drayton Valley and Whitecourt and Mayerthorpe areas. We've got somebody in Cold Lake who's looking at that area of, Cold Lake and Elk Point, St. Paul, Bonnyville, that corner. We are again looking at some new staff that'll be doing that kind of northwest corner up north of Grand Prairie, that Peace River, Manning, Grimshaw area. And then we're also looking to hire that very southern part of the province to be able to serve that area with the mobile rural navigators. In these first few months, this growth phase, again, hiring and training staff to deliver our programs, our presentations, building those relationships. We've been attending interagency meetings to get to know who's out there and what sorts of resources are in the community so that we can help clients make those connections, and we know what services are available. We've done lots of awareness events in terms of seniors expos, booths, seniors fairs, being able to do a lot of community presentations, again, just to raise that awareness, to get our name out there, to begin connecting with the community. We've done a number of outreach meetings to promote that First Link referral program. We are establishing some office space because our mobile navigators aren't situated in a brick and mortar space, but we have built relationships and are continuing to make those connections to establish office space, once a month or so in a variety of different communities. So we do have it in Wainwright and Killam and Didsbury and Elnora, and continue to build that again so that people can meet with someone in their community if they want to. They can drop in, they can make an appointment. We just have that presence in community. And we have found in the last little while that there's been a real shift, that people are aware that we're in these communities, and we've got organizations coming to us, or various continuing care sites coming to us and saying, can you come out and speak? Can we meet with you? Can you come do a presentation? So we're really seeing that shift in awareness and having people invite us to come and present or speak to staff. So that's been a fantastic shift. And then, just if there were any questions, it was a real short, sweet little presentation that I had.
Barb, yeah, we have a couple of minutes here for this section. If anybody would like to ask a question of Barb. Oh, lots of cheering on there.
Oh.
So yeah. I just see from Robin there in the chat box around hoping to be able to make a connection with you to talk about it's Shannon and Jennifer that are in the Northwest and Northeast around joining maybe the North Zone Health neighborhoods there. So Robin, I encourage you to reach out to Barb. I think we'll have your contact
Absolutely.
information that we can share with people, and
Would love to talk.
yeah. Great. Okay. Well, maybe we'll move on to Sarah then for your presentation, and we'll have some time at the end for more discussion also.
Okay, absolutely. Let's see, that looks all right to y'all?
Great.
Perfect. As if you ever want to reach out to Barb, but really any of the team, everyone will take you up on that. Such an incredible, passionate group of people here at the Alzheimer Society with such deep knowledge and community bases. And so we'll be thrilled to connect with all of you. My project, the one that my team supports, is a mouthful of words. And so for now, we're going to think about all the ways that we care for people in the harder moments of their lives. So I'm Sarah. I'm part of the Palliative Approach Grief Supports and Mindfulness team. And really the thing that I think is important for us to remember is that grief is just such a common human experience. So grief is a response to loss encompassing psychosocial, spiritual, and physical dimensions, with micro levels of aspects further reflecting and interacting with our society backgrounds, our cultural backgrounds, and our historical dimensions. And that comes from 2024 research in Springer's Siprick and Smith's book. And so when we think about the language of grief, it's obviously a language that predates the Latin etymology that's on the screen, but it's about that sense. We've understood grief as a sense of heaviness or weightedness. That can be tied to deep sorrow. And so it touches every point of our human experiences at various points along our life, with tangible and finite losses, as well as symbolic and non-finite losses. It can be an old companion or a fresh wound. And so, of course, that means that as we support and are part of a community of people living with dementia and their care partners, that they experience grief and loss at many moments across a life progression, as all of us do, and find different ways that we interact with it. And that's part of what this grant is. It's about integrating palliative approaches and supports throughout the dementia experience and being a resource to everyone in that team, acknowledging that it's not one thing for each one person, but loss and grief is something that occurs across a lifetime, but needs support so we can live our fullest and best life. So I'll just keep going here. I think this is still working for you. Really, one of the main things that we consider from our incredible team. So like the other projects, we focused on bringing in staff and partners who have specialty in backgrounds of grief and loss and dementia supports. And the approach we've taken in terms of looking at how we support grief and grieving for both people living with dementia and care partners and communities that support them is from this continuing bonds model of grief, which just reframes the relationship throughout a life well lived, including a life living with dementia, from any moment through past bereavement. And so it considers that we not only live in the presence, but we are informed and imbued by the memories of our past, and we anticipate and live into the future. And so in a relationship, we acknowledge that that relationship extends long beyond when a person moves away from us or dies, and that need for support continues on. And our incredible team here at the Alzheimer Society really has been partnering with people all along the way, from their dementia diagnosis on. And that not only includes just the person with dementia, but all of those circles of support around them. So we wanted to find ways to be a part of that. Because when we think about, again, grief is that thing that we all know that's so human. That uniqueness about dementia grief is really that weightedness of remembering the past, but that concern around the future, because of the losses that come with not only having that serious illness, but the challenges that come with cognitive changes around dementia. And so when you think about dementia grief, it really is often presented from the care partner perspective of that anticipatory and ambiguous grief, thinking about what will still occur and being consumed by that worry, and that ambiguous grief or loss even of having a person who is still with you, but who has changed. And so how do we support people in those experiences? How do we support the communities that surround them to give them language to name, normalize, and validate their experience and integrate so that they can have a fullness of life in the midst of all that they're doing, just like for all of us? One of the incredible gifts of this project is that we're able to provide grief counseling. And so one of the things that our grief counselors say, both therapeutic counselors and psychologists, is that all of those first several bullet points around different types of grief, anticipatory, ambiguous, cumulative, disenfranchised, delayed, or masked, these are all normal and healthy grieving. These are all things that are a part of our life that we need to take time to breathe into, to live with, to have supports from our community that are meaningful for us and appropriate to our experience to provide support. There can be times when grief becomes complex. So it's a prolonged grief disorder. Think of it as a health condition, right? And it can be described as that open wound that never heals. And in both cases, we look to meet a person where they're at, identify through some psychometric assessments and other therapeutic and supportive tools, ways that we can be resourced and supported to one another. So from our project lens, what we really want to do is think about the ways that we can be of support to someone who's holding this heavy thing, who's managing grief, who's managing a serious illness, who's managing change and loss and transition. And so what we seek to do, and again, this is just like the other projects, is always in partnership with all of you, with the entire community, is to look for ways, first off, that we can hold what is heavy by learning ways to carry things better. So just like if you have to hold something that is heavy physically, you need to think about how to manage your body and your movements and make your plan. When you're thinking about grief care for ourselves, we need to think about grief literacy, palliative planning. So palliative approach is that looking at how we can change our focus to bring in tools and supports for all of us and bring in resiliency and mindfulness skills. Next, we really want to think about how the other ways, if someone is carrying something too heavy for them to manage, that human instinct is to see how we can help. And so how can we as a community, each of us, help carry those pieces for the people who are close to us, for those communities that we're embedded in, the rural communities, the cultural communities, the business communities? How can we be a support so that one person isn't holding a load too large for them to manage? So of course, we have incredible support groups, which by the way, are managed across the province in person and online by staff, but also by an incredible set of volunteer facilitators and our a great resource. We also have peer support grief programs that we run with partner societies and compassionate communities workshops and trainings in partnership with PalliLearn. And then finally, as I said, that grief counseling, how do we process out what grief means, give people the therapeutic skills and ability to look at what's meaningful for them. So we're able to provide one-to-one and group counseling from diagnosis through to bereavement for care partners, as well as we're engaging in a brand new project with the University of Alberta partnership through and special EMDR therapeutic treatment, which is virtual chance for people to help think about how to process out trauma and grief as they're experiencing the dementia illness. And really, we want to come back to the sense if we're embedding that palliative approach into all that we're doing across our society and the work that you are doing in caring for and being with people, it's thinking about that sense of how we wrap people in comfort. It comes from language out of the 1970s in Canada. A doctor in Montreal, Dr. Mont, who was looking at what does this extra level of care look like for people who have a serious or life-limiting condition? He came up with this, again, from the Latin pallium or palliare, and that sense is to cloak, to envelop, to bring comfort to people in need of support. And that's, I think, part of what our society has been able to gift people who've encountered a dementia diagnosis or communities who support them. We want to offer services and supports just like you do. And I think it's the whole network of us that does this. We want to shift to using a palliative approach, which is adopting principles of palliative care earlier in the course of a person's life-limiting condition, adapting strategies to meet the person and their self-defined family's needs, and embedding practices into usual care settings not specialized in palliative care. And that comes from the iPanel U of Victoria palliative approach work. And so how do we adapt and embed that wrapping and comfort approach? It comes down to each and every one of us. And so, we, just like the other teams, offer, practical resources. We're at fairs and presentations as well. One of the fantastic gifts of this part of the grant, of this project, is an opportunity to work specifically with faith communities, faith communities, because that's one of the places that was recognized as a place of support for people in community. And how can we develop out resources and skills in the communities people are already living in and doing their best to care for one another in. So those are available to faith communities, but as well as programs, webinars, and other resources. One of our other great teammates mentioned volunteers. There's going to be volunteer recruitment coming up again soon. So I'll just stop. And as one of our last, I think both Christine and Navjot talked about, is our fantastic Help for Dementia webpage. I'll just put up the links here. We also have a fantastic webpage that'll be promoted as part of an anti-stigma campaign coming up this fall. So that will link you back to this page. You'll see that More Than a Moment come up on news radio and other media spots. We've also developed a memory wall, so a collective memory space for people to bring pictures and know that their person living with dementia who has passed away now is still remembered, that those stories are still living, and that we support one another our whole lives long in our community. So that's the end there.
Thanks so much. That's great. And that leaves us some nice time for discussion or questions. So just open it up to the group here for anything that you have. We did have one earlier on in terms of, and I think more related to Navjot's presentation around food and the role of food in terms of dementia. But anybody else also? Do you take virtual volunteers, is in the chat box? Then we'll go to Navjot for the food question, but if anyone wants to talk about virtual volunteers. Anyone?
I can maybe jump in on that one. To be completely honest, I don't know what that would look like. I mean, we definitely have online programming and things like that. So I definitely think we're always open to volunteers. We absolutely always appreciate when people are willing to donate their time back that way. So I would say just please reach out to the society, and we can get you connected with our volunteer coordinator, and she can see if there's an appropriate role for that.
Yes, and Navjot, if you're able to, just after your presentation, see if I can. And if the person is on, yeah. Did you see it there about the food?
Yes.
Okay,
And
go
thank
right
you,
ahead.
Sarah, for sharing that link. So definitely. So food goes two ways. So first one is just around, we know that having a healthy diet, it does reduce your risk of developing dementia, right? It is one of the risk factors. So a lot of the times when we look at, again, this comes down to that inclusivity piece, and part of our project is when we look at a lot of the resources, the diet that they talk about is often Western embedded, right? You want to uptake your protein, eat a lot of beef, eat a lot of chicken. It often does not take into consideration around vegetarianism or the pieces around different food within diverse communities. So a part of that is to have resources in place which respect and acknowledge those perspectives. So that's one of the pieces we're doing with CCNA, is developing their existing brain health food guide and adapting that for the South Asian community. But even moving beyond this, food plays a huge role when it comes to day programs, our long-term care homes. Even during my research, whenever I asked participants around their views on long-term care home, a lot of other things came up, but food was something that always came up first. It is a sense of belonging. It's a sense of attachment to their culture. When we talk about day programs, it's important to have food and snacks that are culturally relevant. We make that effort when we go for our presentations at different organizations. So, we make sure we're taking green tea or snacks that are culturally relevant, and we're not showing up with a pack of Timbits and donuts and a 12-cup coffee. So we always check in and make sure we're following those. When it comes to long-term care home, food has shown to significantly influence the quality of life for the residents, for the people living there. It's definitely makes them feel more connected, more respected. And in the end, it's about dignity, right? There are stories that have been shared within research spaces around people who don't feel connected. They're like, oh, this person is living with dementia. They don't remember what they like, what they're eating. But no, research has shown that is not the case. Care partners have shared how their parent, for example, their mom might not recognize them, but as soon as they feed them that one spoon of their home cooked food, they close their eyes, and they just sigh because they do remember it, right? And that's the person-centered approach that we advocate for here at the society and follow, and something that should be a norm within our healthcare system, is that we respect that person living with dementia. We don't assume just because they're forgetting stuff, they're forgetting their culture, their identity.
Great, thank you. Any other questions or discussions that people would like to have with the folks here? I have a question if nobody else has one. First, of course, I got a couple, but
I was just going to jump in and say too that
sure,
food
yes,
is intricately connected to comfort, right? And so
Mhm.
it's when you're talking about palliative and end of life care, that sense of scent and tasting, even if not able to swallow, is important. As a staff, we recently just did a death cafe, and one of their central tenets is, of course, that you have food. You have that humanizing activity when you gather around. And so finding, like Navjot said, that the food that is appropriate and meaningful is so important, because otherwise that comfort is just sort of a lost opportunity.
Hi, Michelle, go right ahead.
Hi, yeah, that was my question. So I've been doing a lot of work in culturally appropriate food and how it relates back to overall well-being, and myself being a person that has been able to be beside three individuals in the end. What I have really found is that I'm sure, preaching to the choir a bit to say that that's one of the last pieces of autonomy that people have is what they eat. And I think that what I'm trying to get a sense of is within all of the programs that you guys are offering, and from what I've heard from other sources, is that there's a main focus on rural supports. And I haven't heard, not that you guys don't, I'm not saying that, just trying to figure out how I fit into this, and that is the culturally appropriate food. So there's all kinds of ways for people closer to bigger centers to get access to culturally appropriate food, even if it's not as available. What is something that maybe some ideas of how to incorporate a portion of that rural network that you guys have already established and already have this in? Barb, your mobile one, kind of something in that line. I'm just trying to figure out how I can put something together to do that, because yes, like there's the nutritional component, which is absolutely important, but for me more it's more of a focus on the community building and the memory, music and food are universal languages, right? So that's where I'm kind of trying to see where I could fit in. So
No,
if anybody
and,
has any
and
ideas.
Yeah, go ahead, Barb.
no, I was to say that is a absolutely fantastic point, and I'd love to chat more. With the Mobile Rural Navigator project at this point, truthfully, that hasn't been uh, a significant consideration or something that we've been really consciously
Mhm.
pursuing at this point. So it definitely
Yeah, I suppose I'll
something to
connect
look
with
at in
you
the
and see if
conversation.
there's
Yeah.
something. I want to make sure that wherever I pursue, efforts in this area, it's based off of what people are actually wanting.
Mhm,
And obviously, it would be ideal if there could be community and culturally appropriate food in those rural areas, but the reality is that might not be the case right now.
mhm.
So maybe it's just getting culturally appropriate food hampers or whatever it may be to your rural team and then distributing it more like a hub. I'm not sure, but
Yeah,
just as
but we can definitely chat. And Navjot, it might be something that makes sense for you to also be part of the conversation. Right? But yeah, we can
I'll
for
just
sure
add
talk
also
further.
that within the rural communities, our family and community support service partners are often have a lot to do with food security and helping people to get the appropriate food. So whichever communities you're looking at rurally, then I think that's someone to reach out to also, Michelle.
okay. Thanks.
In there, yeah, yeah. I'd love to hear more. I think I'll reach out to you to hear more about the work that you're doing also with it. So that's great. I think the one thing I was wondering about, and maybe Barb, this question might be for you, is some of the communities that we work with do have support groups and memory cafes kind of already established, and wondering what role do you think your new navigators are now then able to play with those established groups? Yeah.
Yeah, and that is, you know, one of the things that we're looking at in connecting with community, that we have our mobile rural navigators, where possible, be the primary society liaison for those volunteers and be
Right.
that connection point, because again, they're in or near community. So
Mhm.
really trying to take as much back to community
Mhm.
as we can,
Yeah.
while still keeping that connection with the larger society.
That's great. So we'll do some work around making sure those connections get made then in
Yeah, for
the
sure.
areas that we know of. That'd be
Yeah.
super. To see here from Ginger just saying rural Albertans are very creative and love when folks encourage and support them in meeting their needs with local partners and resources. So yeah, I love experiencing this in action. Yeah, it's very empowering. You're right, Ginger, there. I think that was one of the things, more of an observation, because I think it's been really interesting for us in our initiative, and then working alongside, we've had this close working relationship with the Alzheimer's Society, and then also as we see Healthy Aging Alberta coming along, to see how we're building these a network of provincial partnerships, right, that the communities can tap into and take advantage of these different resources. So I think, in terms of Alberta, I think we're pretty innovative in terms of being able to develop that bit of a structure of support there for the needs that we're seeing within those local communities. So love it that we've got these relationships ongoing with them. Anything else that people would like to ask? We've got a few minutes, otherwise I can go on to our resources and okay, I'll try sharing my screen, see if I can bring up the right one again. Yeah, great. Yes, so we just have a couple of things that we wanted to share. One is a community event that actually the Westview Dementia Collaborative, they're based out of Stony Plain and Spruce Grove. They've always held an event for Alzheimer's Awareness Month in January, the national one. And so they've actually been able to bring in Jonathan Patterson, and he does a show called How I Met My Mother. And so just wanting to let people that's going to be playing in January. Do we have the date on there? I don't see the date, but anyway, you can get a hold of the Horizon stage for the getting tickets from there if you're interested in going to that.
It's January
then,
9th. Sorry.
Thanks, Kate. That's great. And Kate put the link in there. And then this was a TED Talk that I just came across, and I just thought it was interesting to watch. So it's by Carl Honoré, and why we should embrace aging as an adventure. And so some of that, as we all do, trying to tackle the stigma that can be out there and that we see towards people living with dementia, but also just as we age also. So I think, yeah, this is just our regular contact information, and to let you know that through the group on connecting people and community for living well, on the core places where you can find the recordings also, but we will send out a recording of this meeting. Okay, so I think that is everything. Is there anything else that people would like to share with the group? Otherwise, we will see you in November.